Hi, everyone. My name is Corey Greenleaf. I'm the Director of Performance Improvement here at Brownville Memorial Hospital. Today's presentation is on improving patient satisfaction and our family ratings. So we recently got our yearly surveys back, and we weren't too fond of some of the information, and we really wanted to roll out a few initiatives in some areas of concern that we think will really help us going forward to see better responses from both our patients, their family members, their friends, and then also our own staff. How can we influence change? And our goal is to start this at the basic level of health literacy. Our patients need to understand what's going on and how we want to help them, and make sure that they're involved both in their care, in their methods and procedures, along with the hospital staff. We want this to be a common goal between the two. So we're going to look at two areas of focus here. The first one is just helping patients to remember how and when to take their medication. This is so crucial, and we're seeing this as a big concern in our older populations that they're forgetting to take their medications. They can't afford their medications. They can't get them on time. They're not scheduling them correctly. The doctors aren't informing them maybe a medication needs to be taken at a certain time and it's being taken at the wrong time. There's a multitude of issues that can go around this one area of concern, so I will talk a little bit more about this in detail. The second one, not as much, but still very important, is encouraging our patients to ask questions. Now, this can be difficult, and there's a lot of methods that go along with this. It's not as simple as it seems. And I left a note here, nearly half of all Americans have difficulty understanding and interpreting their healthcare information. So this shouldn't be surprising, but we need to find better methods to approach this barrier. How can we make all of our patients feel comfortable with what they're being told? Because a lot of this information that doctors and nurses and pharmacists and practitioners relay to their patients, we can't expect that to all be understood. But how can we make it as easy as possible? To our first area of concern, the importance of medication management. Just a couple real quick bullets on this. Like I mentioned before, our patients feel overwhelmed. This affects our patients both emotionally and physically. They're leaving the hospital, and not only are they recovering from whatever it is that they were in the hospital for, but they're also psychologically drained from all the information that was given to them. They need to go and get their medications. They need to start taking them tonight. They may not have the money to afford those medications. How are they going to pay for that? All of these barriers are just going to negatively influence their health. And we don't want our patients just coming out of the hospital already getting setbacks because of issues such as this. So paying for medication, we know it's no easy task. This is where, we're going to outline some ideas on how we can help this. And like I noted a little bit before, our older patients who care for themselves, they're easily forgetful. They fail to take the medications. They might not understand why a medication was prescribed in the first place. So they might just be, resentful in a way. They may not like the doctor or the prescriber, or maybe they didn't get enough information from the pharmacy and they just think, it's just another drug. It's just another pill. What's this going to do to help me out? I don't need to take this. So our medication management plan that we're going to be rolling out is going to be called a prescription assistance program. Now, here in my colleagues over at Maine Health, where I used to work, we had two programs called Care Partners and MedAccess, and we're going to be rolling in one called Care Partners. And this will target patients with insurance that won't cover everything. So like Medicare beneficiaries, it's okay insurance, but it doesn't cover everything, and it's also going to cover people who just don't have insurance at all. We're going to put significant funding into this plan, and we're going to start helping patients enroll in this plan. The first step is to get them linked up with a provider. Who's going to be their primary care physician or PA, or maybe nurse practitioner? Who's going to take care of them on a monthly, yearly basis, depending on their age and condition? Who's going to see them at all these appointments? Who's going to sign their prescriptions and send them to the pharmacy? The next is to roll out the referral database for pharmacists and the other doctors and professionals to send these patients to the case managers at Care Partners. So they have a patient who comes in that, they're very worried that they can't afford this medication that the doctor's prescribing them, but it's crucial to their health. There's no other options. There's no other generics. This medication needs to be taken. How can we get this taken care of? Let's give Care Partners a call. Well, calling, it's not as easy. We leave a lot of voicemails, play a lot of phone tag. It's not so fun. How about we set up a referral basis in our database system? And that's what we'll be rolling out in the coming months. There'll be a direct referral system that a doctor or any provider can directly refer a patient over to this case manager. Case manager will reach out to them, screen them, ask them about income, household, their situation with insurance, what barriers they have to healthcare, what can we assist them with? And this is going to take time, but this is really something we're very confident in, and we've seen a lot of success in other studies that we've done. Um, Lastly, we're going to create a flow chart for these medical professionals to follow when discussing the medication management. So our doctor who visits with these patients, and not just these patients for Care Partners, that's going to be the rollout plan, but just patients in general, we're going to have an outline of how to discuss these medications with them. And we're going to use the teach back method. And I'll talk a little bit more about that after, but telling the patient exactly what the medication is, describing why is it used, what is it needed for, and how is it going to help them down the road, and what's the plan? Is this going to be a yearly thing, maybe the rest of their life thing, maybe just a day thing? I mean, what is this going to be specifically? And having the patient tell this information back to the provider. That way we know that the patient understands and they feel more engaged in their care and they're active. And this is something I will touch on again, but keep that in the back of your mind. And like I just said, getting patients involved in their care. So we know our patients leave the office feeling unappreciated, and we've seen this in recent surveys. They don't feel like they're taken seriously, or they just feel like a lot of the information goes over their head, and their doctors aren't appreciating them fully. So how do we get patients engaged in all aspects of their treatment? And this is in a multitude of ways, but the biggest is just in those conversations, those one-on-ones, even if it's just for 10 minutes, using that conversation to appreciate the patient and understand their situation and how we can detect their goals, their future goals, and their life struggles, and be a little bit more. These one-on-ones are just going to be so important, and we're going to do an activity that'll kind of go over this in a little bit more, but this will increase the patient's health, and they're also just their overall well-being. This requires work at all levels of care. So our nurses, our pharmacists, our doctors, our case managers, our social workers, everyone's going to we got to be more of a team, and this is where this medication management plan is going to be really important. So these two concerns kind of come together. We want our patients to start asking questions, but we want our patients to be able to afford, the medication that they need and their care that they need, not just medication, but the doctor's visits that they require. We need to be able to hone in on these goals. So the patient engagement plan we're going to roll out, and this is number 2 in assistance to the medication management plan. So we're going to roll out new initiatives for our medical staff. Now, these are all our providers who receive good ratings and credit from their peer and patients, and this will be from surveys to come. Like my colleagues over at Maine Health, we have a program which we call Moment to Shine. Now, Moment to Shine allows providers and their peers and their management staff to recognize each other and promote each other from within, and get gift cards and maybe a small bonus, or just a level 1, which is a thank you, something to show appreciation. And we're also going to do this at the patient level. As a patient submits online a survey from after their hospital visit, whether it's just a 20-minute visit with a provider or if it's a 3-day, 4-day stay, what is the survey saying? And we want to recognize those providers who are showing really good ratings, and that's where we're going to focus more on our initiatives going forward. And these are where the raises are going to come, the bonuses are going to come. This is where we're going to start ranking ourselves, our programs, who are going to get more funding. This is really important to how we're going to go about our care team. So we're going to implement the monthly review meetings for the different levels of medication staff. So for instance, at the pharmacy technicians will have a monthly review with their managers. The pharmacists and the pharmacist directors will have a management meeting. The PAs will, the doctors will, depending on their specific specialties. And this is where they'll overview. Every month they're going to look at what are our friends saying, our colleagues, our management staff, and most importantly, what are our patients saying about our care? How important is that to our team? How can we improve? These monthly meetings are going to be a kickstart. In a few months, we're going to have our first monthly meeting, and it's going to be really exciting to see where we can go. And just a better team engagement is the ultimate goal here among our current staff. We care about our patients, but we also care about our providers first, and to take care of our providers first, we know that they'll be mentally and physically ready to give our patients the best care. So just want to define health literacy real quick before I enter into an exercise we're going to do briefly. So health literacy, just to give a basic definition, this is my definition. It's a provider-patient relations that lack any barriers. There's no walls there to treatment and education. Basically, you know what you're being told and you understand it. It's that simple. Direct communication brought in a much more simplified manner between providers and their patients, and patients feeling more engaged in their treatment and in control. That's difficult to say, because the doctor's in control of the patient's chart. They're regulating their meds, their treatments, their shots, their blood work, but the patient is the one in control of their health, and we need to know that, let them know that they're in control, and that's just so important. So some successful interventions and methods just to touch on, those that focus directly on the provider-patient communication. Just a real quick example, the Georgia Alliance for Health Literacy campaign just touched on a bunch of these ideas, and I'm sharing a flyer with the team that you guys can look into these more, but marketing strategy is a big one on how we're going to promote our staff from within on these goals. For future goals and objectives, identifying these at our monthly meetings, and then reflection and coming up with new proposals going forward. We're going to outline some similar to this Georgia Alliance for Health Literacy campaign that saw much success. Keep communication principles. We've already talked about this. I mean, you can see this wheel: be clear, add value, be accurate, be relevant. It really is that simple. We have to simplify everything. Utilizing our materials that are both appropriate and understanding. Using the teach-back method, using guided imagery, pictures, showing patients their charts, showing them pictures of what we're trying to fix and what's not right. Taking advantage of that one-on-one time with your patient. This is so important. The group exercise. So I'm going to roll over this in just a minute here. The objective is to provide patient-centered care through improvement of health literacy struggles, understanding boundaries, empowerment to patients and their families, finding and addressing barriers to care, viewing the care as if you were the patient, having that control, like we mentioned, and a new sense of sensitivity and respect. And just to give the credit, this is from Tammy Spencer, who's an RN at the University of Colorado. She came up with this summary. This is a little bit modified from what she did. Our area of concern is just encouraging our patients to ask questions, feeling comfortable. Like we've talked about so many times in just this 12 minutes I've been discussing, our patients leave our doctor's offices feeling unappreciated and confused. So how do we increase that overall well-being and increase our engagement? The materials needed, and we're going to start this activity right when I'm done this presentation. Just bring an open mind. There's no other materials. The exercise is done through interaction with a one-on-one with a colleague. The participants will be asked to submit an evaluation, which I'll hand out at the conclusion. The activity steps, so I'm going to divide everyone into pairs. Each participant will play a different role, a nurse, pharmacist, physician. One patient will be the patient, and we're going to do some role play. Files will be provided to the patient, depicting a serious case. Some people might have a less serious case. Some people might be just a generic physical. And participants will share their own experience. So what culture do you come from? What's your your reading level? Can you read or write? How understanding are you? Things along those lines. The evaluation, just to jump into a little more, so our participants, you all will be evaluated. We just want to know about your experience and how it went. Does this exercise relate to improving health literacy, do you think, with providing our patients with a better understanding of their care? What frustrations can you depict in the role of the patients that you can improve on personally? What changes will you make going forward? And these are just the final references, and I didn't want to do a Q&A slide here, which we'll touch on after. But in summary, our medication management plan is going to be a big one, and we're really excited to roll that out in a few months. And then we want to combine that with showing our patients, getting our patients to ask more questions and improving our one-on-one time. And I know this is a lot of information. I want to thank you all for your time, and I look forward to discussing this with you all going forward. Thank you, and have a great evening.